So this is always the fun part because my screen says we're setting up and at some point we're going to kick on, but I never really start talking
We're on right
completely.
now.
We
We're
are on.
on.
Awesome. And I get a blank screen. I just love this. I'm going to eventually figure this lovely technology out. In the meantime, we're just going to have fun with it. But welcome. We have made it. We have arrived. And thankfully, Mindy was able to make sure that we knew when we did go live because I'm still trying to work that out. So thank you so much. But welcome to It's Time to Excel. I'm Janet Ickes, and I am very blessed and honored to have my friend Mindy Sutherland with me today as we get an opportunity to kind of navigate a world that is confusing to a lot of people, and that is that world of healthcare coverage. And especially in today's world, my goodness, we are in the middle of pandemics. People are confused, people are overwhelmed, the list goes on and on. And I'm so thankful that you're willing to take a little bit of time out today and to join me. And, my goal is very simple. I want to inspire and I want to ignite the possibilities that are out there for others. And I just want them to be able to excel. And I'm encouraging and inviting them to excel with us today because it is that time. So, Mindy, I know that you have been in healthcare for just a couple of years,
A little over
about
20
20,
overall. Yeah.
so just a couple of years. And you're also a little bit of a northerner like me. So probably between the two of us, I know that I love to talk a lot faster than a lot of our southern folks here. And they have been working with me diligently for the last several years to make sure that I can do a little bit better on that. I'm trying hard. Thank goodness they're willing to work with me. But so you have a very broad background to actually bring to us to kind of help us to navigate this crazy world. So would you mind sharing a little bit about yourself so that our audience can kind of get a feel of who you are?
Right. So I'm Mindy Sutherland. I am an independent agent that handles health and life insurance. I am partnered with Healthcare Solutions team, and I'm licensed in 22 states. So I have done it for the reason that I want to help as many people as I can. As Janet mentioned, I have a healthcare background. I was an EMT and a registered nurse in Ohio. So I do understand, I have a lot of healthcare background, so I kind of understand a little bit about how things can proceed as far as a medical expense, injury, illness, and so on. I can say that from my experience that the time to find out you need health insurance is never when you don't have it and you have a medical experience.
When we think about it.
Right. And, sure, health coverage is not necessarily the most fun thing to think about. And I'm sure we can all think of lots of fun things we'd want to spend our money on. But I can definitely tell you that the sense of relief you have knowing that you've got something that's going to cover those expenses when something, God forbid, happens is priceless. You just can't put a price on it. As Janet said, I am from North Central Ohio, so I'm definitely not a Southern girl, but I have been in North Carolina now since 2017. I love it here, and I'm really happy that I was able to have the chance to come down this way. I have 3 children. They're up in Ohio. They're all grown and on their own. They know everything already, so my job is done. Anyway, I am really passionate about helping people. That's something I've always had a strong passion for pretty much my whole adult life. I was on a volunteer fire department. Again, I worked in an emergency room in a hospital. I worked at a steel mill even as a EMT and security officer, believe it or not. Wow. So I really have been able to, luckily had an opportunity to be able to help people in various situations. And health insurance is actually something that I definitely have a passion for, because I actually, 25 years ago, I had a serious health issue that ended up costing me a lot of money. And unfortunately, back then, I didn't know anything about health insurance, which did cost me over $100,000. Oh. Now, when you're in your early 20s, most people don't have over $100,000. So
it'd be nice if we did.
Well, yeah. So I actually had to file bankruptcy as a result of it. And it was because the health insurance that I had did not cover the particular doctors I was using. I had no idea to even ask that question.
Oh my goodness.
I had the card. I thought you just go to the doctor, you hand them the card, magically everything's taken care of. And of course, at the time, I was focusing more on my health than I was on what my insurance was going to cover. And it cost me a lot of money and a lot of aggravation. I remember calling
Okay.
the insurance company to find out why was this not being covered. And she said, honey, you chose the wrong doctors.
And that's
And
all it was,
and that's
because
what
you
it was.
didn't know.
I went to out of network doctors, which is one of the things that I really try to tell people, to make sure the people you go to are in network. That is where you're going to get the most benefit from your plan. And
Okay.
if you don't, it's going to cost you a lot of money. So that's kind of
And
why
that
I
makes
really,
sense. And
yeah. So I'm really passionate about educating and advising to help people find the right coverage for them. Because at the end of the day, I want my clients to be happy and know that I'm there for their best interest. So that is really my passion and why I do what I do.
And that's
So,
wonderful. And I want to thank those that are joining us as well. Hi, Anna. She has joined us. And I know
hi,
that we
Anna.
have a few of our friends that,
Yay.
often do drop in and support us. And we are grateful for that. And we've met at some networking events. And
Mm-hmm.
networking is very different now. Um,
Yes.
so this has just been a great opportunity and a way to kind of get back there. So would you mind sharing some things of what can we do? What can we be aware of? What questions do we need to be thinking of? And when we're starting to evaluate what our best options are.
Probably first and foremost is you need to know what is the most you will have to pay for your health, for your medical expenses. There are a lot of plans out there. And some of them offer very low premiums, but the problem is they don't always have a stopping point, which means you may ultimately owe an unlimited amount of money. It only pays a certain amount, and you might continue to have to keep paying beyond that. So
So you
you
mean it
want to
only
make
gives us to
sure.
a certain amount?
Exactly. So that you have to be
Oh,
careful. They have low premiums, but they have a stopping point. They only go so far. So you have to make sure you know that. Having a deductible, which means
hmm.
this is how much you will have to pay before most of the options will be paid for. Some plans have copays built in, or certain things, certain benefits are built in to start kicking in automatically. But for the most part, you have to meet a deductible first. You want to make sure, are you able to meet that deductible?
Okay.
And also there's a max out of pocket that is in addition to that. And that is where your co-insurance, that there's all these
So there's
terms in
all
there.
these terms. As I say, these
Yeah.
terms are coming out here, and it's no wonder people get a little confused on that. So you
Mhm.
mean I have to pay deductible? Wait, I may not pay everything. I may
Mhm.
not co-insurance. So all of
Mhm.
these words, they actually mean something. And I think too
Absolutely.
often than not, we don't even know what direction we're going. So when they're talking one or the other, we're mixing them up or combining
Mhm.
them or just completely glazing over.
So the biggest thing I can say with that is know what the most you're going to have to pay in a year for
Okay.
your health insurance, and make sure that is something you're comfortable dealing with, because you could have a large bill and you might have to come up with that money fairly quickly. So you want to make sure you're comfortable with that. And of course, you want to make sure, as I said before, you want to make sure your doctors are in network too,
Hmm.
because that is where you're going to get your most benefit. They have
Okay.
negotiated rates with the insurance company. That's why they're considered in network. They give a lower rate typically on their plans. And then also the insurance company in turn also offers a larger benefit for those doctors than someone who is not in network. So, you could
Okay.
have a $10,000 medical expense, and you might only owe $5,000 of that with an in-network doctor, that, with deductible and everything, but you might owe the whole 10,000 with someone out of network. There's a big
Aha.
difference there.
I was going to say that can make a very huge difference in what
Absolutely.
you're trying to deal with. And
Right.
especially if you're needing your health insurance anyway, logically you may not be working like you were.
Right.
So that's not the time when you're so emotionally, drained as it is and physically drained. That's not the time to try to figure this out. So
Right.
I would be guessing that, especially when people have questions like that, they need to come to someone who has some background. And I know that's one thing I would never have a hesitation of, sharing your information with anyone, because I know that you have their best interest at heart. and you are
Absolutely.
trying to make
Yeah.
sure, as you said, what are they going to be up against? Are they prepared for that? And if not,
Right.
how can they get prepared for that? Or what
Mhm.
options? And I suspect that there's a lot of options out there.
There are so many options. Of course, everybody's heard of the Affordable Care Act, healthcare.gov. There's that. There are plans through an employer. So if
Okay.
you might have an employer who offers health coverage, so that's
Mm-hmm.
another option. There are different plans through private insurance companies that are maybe a short-term plan. There are options out there that can write plans up to 36 months. As well as then
Okay.
there's and those are great options for someone who maybe is in between jobs, maybe are
Mm-hmm.
not able to for whatever reason the Affordable Care Act is not going to be a good fit for them for the moment, but they need to have something to protect them, in the meantime. um, Also, there are faith-based share plans, which are not actually insurance. So they are actually monitored by the IRS rather than the
Mm-hmm.
Departments of Insurance. But they are an option for some people, and some people feel totally comfortable, using those types of options. And then there's a lot of plans that I like to use kind of a fill-in, and those are
Okay.
limited benefit and fixed indemnity plans. And those are really meant to fill in out of pocket expense gaps like deductibles. They're getting you so that way when you do have something going on, it kind of helps. It fills in a little bit of that expense. So you're not paying so much
Okay.
out of pocket. You pay a little bit, obviously, for the premiums each month. And honestly, that's going to be something too that we want to match with your needs and your budget. I want to obviously make sure that the people that I'm working with, they can manage those premiums. I mean,
Mm-hmm.
there's no
Sure.
point. I could write them I could fill a bundle up with a bunch of stuff, and if
They
they
can't
can't make those premiums,
premium.
it's not
Not going
doing
to
them
do
any
them any
good.
good. And
Mm-hmm.
that's very true. And a lot
Right.
of times you hear these high deductible plans, these low deductible plans. And what folks I think really need to understand is yes, you may have a high deductible plan with a lower premium, but then that means you get to cover more of the out of pocket before it gets there.
Right. And for
And it's
some
a trade
people,
off. And it
right,
depends on and I would agree that that's why
exactly.
you love to talk to folks because it's
Yes.
so dependent on the individual's ability. It's dependent on what their circumstances are. And that's going to vary even between you and I. It's going to
Mm-hmm.
vary.
Absolutely. Every
Is there
single
another
person is
spouse? Is
different.
there children? Is there, is it a self-employed person versus someone who has a regular paycheck?
Right.
And right now, that's all up in the air, I think, for all of us.
Right.
None of us
Right.
know what's going on right now,
Mm-hmm.
but
I,
I can
and
see where
I,
that can be confusing.
right. And I have helped a lot of people that are in a transition period due to
Sure.
COVID-19 right now, because obviously they're needing to find different alternatives for health
Mm-hmm.
insurance. Maybe they've lost it through an employer, or maybe they're really just trying to pare down their expenses to be a little more manageable. Maybe their income's dropped, or maybe they're just wanting to put a little more in savings. They want to keep their costs down.
Okay.
I work with people to really give them options. I educate and let them make the choice
Okay.
ultimately, because I want them to feel comfortable and confident in what they've chosen, because I don't want them to feel like they've ever been sold. I want them to feel like they understand and that they know what they have, and they understand how to use it. And if they don't, they also know they've got me to come back to and
I was going to
ask.
say, and when the questions come up, I would suspect you're a phone call away
Right,
or an email
right.
away, whatever you
Hmm.
want to say in
Absolutely.
this
Either
lovely
one.
world.
I get both all the time, and that's fine. That's why I'm here. And I think that's why it's so important to really have someone that you can trust to use rather than just trying to go through the internet and trying to do searches, because there's a lot of confusing information and there is some
Yeah.
rather misleading information out there too. So you really have to be careful what you're looking at. Something can sound amazing, and there are times when it might be too good to be true. So
And how often do we not know what we don't know?
right,
And you
exactly.
cannot believe everything, that you do
Mhm.
read and sometimes we interpret things the way we read them too.
Right.
So whether it's true or not, it may be very, very factual in what it's saying, but at the same time, we're just not, and there's so many terms out there. And I know I get that a
Yes.
lot with when I start throwing accounting terms out there, I got to remember, okay, take a step back, because
Yeah.
just because I used it for the last 20 years doesn't mean that everybody else uses that same lingo.
Right.
And just like
Right.
you brought some terms up there, and I'm like, I could just see some like there's just so many terms. I'm like, and you start reading that, you feel like you're reading a legalese of
And
where,
kind
and
of are. I mean,
I'm
it
like,
really is.
okay,
Yeah, I mean, you really are. In a lot of ways, it really is kind of like a legal contract. And,
hmm sure.
if you don't know what the terminology means,
You don't even
it,
know
how
what
do you
you're
make a
reading, let
choice?
alone how do you make a good choice for you,
Right.
because you don't even know what to ask to say, okay, if this means that, you don't even know where to question something.
Mm-hmm.
And
Mm-hmm.
once again, back to the fact that at least you're on there, someone that they can trust that can say, okay, I don't understand what's coming on. Can you at least give me my options
Right.
and see what those options are? And most of the time, that's what we're looking for. And then
Mm-hmm.
help me to guide me to be able to make what's going to be best for me in my certain situation, which may change next year.
Sure.
So I would also say, working with someone as well, like yourself, would be
Mm-hmm.
able to connect that each year. Maybe you need to reevaluate it each year. Do you often do that
Absolutely.
for your referrals? I
Yes.
knowing you have a long-term relationship with your employees
Yes.
or
Yeah,
with your
I
clients.
tell my clients, okay,
hmm
it doesn't end at the sale. You're stuck with me. So I'm going to be checking in to see how this plan's
hmm
working for you. Maybe we need to make an adjustment. Maybe and every year I'm always, calling my clients up to set up a time to discuss how the year went.
Okay.
What do we need to change? What things in your life have changed? What do we need to add or take away? So on and so forth. Because as you can see, 2020 has been the year of changes. So obviously people, and lives change all the time. So obviously their needs are going to change as well. So
And that's
yeah,
true.
I
And I think this
definitely,
2020 has magnified everything at this point, good, bad, indifferent, all over the place. Most days,
definitely.
I don't even know what day of the week it is.
Right. Yes. I
That
know
definitely is a challenge.
if I didn't have a calendar on my phone to say what day of the week and the date, I'd be in trouble. I would
Me
really be
too.
in
Me
trouble.
too.
Mhm.
Well, I know right now we cannot travel, but that's always something that's always been of interest as well is what happens if I did go on a trip? Like, okay, we're not traveling right now, but it's just not something, we often think about, but we probably should. Are you covered when you go on trips and things? Is that something that is sometimes different?
Yes, there are plans that they only cover a specific region. So you really need
Ah,
to know, if you, maybe, for example, maybe you're a snowbird, maybe your plan,
okay.
maybe you live part of the time in the north, the other part in the south, depending on the season. You need to make sure your health coverage is going to carry you in both places.
Okay.
Things like that. Somebody who does a lot of traveling. I have a lot of families who what are called full-time families. They live in an RV or a camper of some sort,
Oh,
converted buses, and they live all over the country. They move around from place to place and homeschool their
okay.
kids. So obviously they need plans that are going to match those needs
hmm
because there's a lot of plans that maybe are only localized to one state. Well, obviously they're not in just one state. So I try to find options for them as well. So that's really important to know, what will happen if you are out of your service area.
Which goes
Um,
back to that out of network as
right.
well,
And
and very
now
quickly.
I will say most plans will pay for emergent care if
hmm
you are traveling to somewhere in the country and maybe an emergency of some sort
hmm
happens. They are going to pay for, most plans will pay as if that is in network because will at least get you
hmm
stabilized. Now, if
Correct.
you end up saying, "Well, this is a really great hospital, I'm going to stay here longer,"
Not so much.
you're probably going to paying a whole lot more for that by doing that. So that's always something to consider. If you do a lot of traveling, you might want to look at a plan that has a broader network of a broader nationwide
hmm
network versus just a regional one. You may even need to add travel insurance when you are traveling. I do offer that as well, a travel medical plan. So if somebody is traveling somewhere, maybe they've got to be somewhere for a month
Okay.
or, even a week. I helped a gentleman go overseas. He had health insurance with me, but the plan itself did
Okay.
not cover overseas. So I was able to write him a plan that would cover him while he went overseas. Now, of course, this was before COVID happened,
Yeah,
but
it's a little tougher to travel right now, but
right.
well, even something similar. I mean, my husband drives trucks, so we don't know what state he's going to be in.
Right.
Yeah, but I did run into a case where I was up in Pennsylvania and landed myself in the hospital unexpectedly
Mm-hmm.
due to a medical condition. And, at least that piece of it. Now, when I got back to North Carolina, we had to, move everything here. But at least I was grateful for having something because that was so unexpected.
Sure.
And, what
Absolutely.
happens, as you said, if you go on vacation, even if we're ever allowed to go on vacation,
Yeah.
but, those are things to be thinking about that we often don't.
Right.
And that makes it tougher, a lot of times. So, and
Yep.
this is such a big topic right now, and we just don't know. And I think if nothing else, 2020 and this COVID has proven is we don't know.
Mm-hmm.
And
Right.
it could change in an instant.
Yes,
And
definitely.
so, and I'm guessing reacting in the instant is probably not their best choice.
No, definitely you want to get it before you actually need it. You want to have it in place. It's never a good thing when someone comes to me. I can tell you some absolutely heartbreaking stories of people calling me up and saying, this happened. I need help. I didn't have insurance before. And now I'm stuck because there's just not a lot of options that are
To
really
be
going to help them, especially if they're in a period of time where I can't put them on something on the, say, the Affordable Care Act
okay.
that covers pre-existing conditions, but it limits when you can put somebody on those plans. They have certain
Oh,
that you
okay.
can only get on during certain times. So if they're on that in that in-between space, that can make things very, very difficult. And it just is, I've lost a lot of sleep and shed a lot of tears over those kinds of stories. I can tell you that.
I'm
So
sure.
I can't stress enough, please talk to somebody who is knowledgeable about health insurance and life insurance and get those things taken care of. Even though, like I said, it's not one of those things that everybody's just dying to spend money on, but you really need it. You really do.
To get that protection and at least take
Absolutely.
that stress off. Because as I said, you're already physically drained for whatever the reasoning
Yes.
is. Let's not add the emotional drain because you have no idea how you're going to pay for the services that you need in the
Right.
time you need them.
And another thing that I tell people is, so what if something happens and you can't work anymore?
Mm-hmm.
And it may not be something that's a workers' compensation issue. It might
Correct.
just simply be something that happened, a heart attack or a stroke, and now you
Accident,
cannot
whatever.
do, sure, it could
It
be,
could even
you
be a
might be
car accident.
you could be self-employed and, and not
Mm-hmm.
necessarily have a workers' compensation plan on yourself. Or it just simply be something
Sure.
like cancer, a heart attack, God forbid. How are you going to pay for your expenses? Those are things I always bring up to people, yeah, let's find you a great plan, but what happens when you don't have an income coming in? Do you have something in
Yeah.
place to help replace, to fill in that time period while you're recovering? Because the last thing you want to worry about is, okay, I'm
Putting
trying
food
to
on the table.
recover, I'm trying to pay these medical bills, and I have to figure out how I'm going to make my mortgage payment every month,
Yeah.
bring in food for,
Keep the
feed my
phone.
kids and things like that. um, I was lucky, many years ago. I was a single mom, and this was long before the Affordable Care Act. I
Okay.
could not afford health insurance, so I went without, and it
Whew.
was a scary time. Every
Yeah.
time I would pray, please don't let anything happen to me. Thankfully, my kids had insurance, but I didn't. And I just know now that is a scary thing. Luckily, we have a lot more options now, and there are so many more
Good.
resources and things for people to find, and to find in a budget for people.
Okay.
I can pair a lot of things. It may not be the most comprehensive, but I will
It's
find the most
something.
comprehensive that is something they can afford. So that is, something I'm very conscious of needing to keep money, having a tight budget for sure. I'd lived that for years, so I totally
Sure.
get that.
And you're looking out for those that you're working with. And I know that you have a no pressure approach so that
Right.
anyone can feel comfortable calling and just asking some questions. And I know
Mhm.
that you also have a free gift for some folks. And I would love for you to kind of share about this nice little gift. And for
Yeah.
any of our readers that are interested, and we're going to post the exact link and how to do that after this call, after we're wrap this up, it's going to be right there in the comment section. But why don't you share with us what you are willing to let us
Well,
take
So,
advantage of?
I am passionate about helping people, and it doesn't matter whether it's something that I can offer them or not. I want to make sure they understand what their needs are, so that I offer a free
Okay.
consultation to anybody who reaches out to me. I don't charge anything to have that sit down and talk with them and go over options. Maybe the plan they have is the best fit for them. Maybe they just don't know how they need to use it. Maybe they don't even realize that this is their best plan, or maybe they've been
They don't know.
paying an enormous amount of money for something that just isn't fitting their needs, and there's something else out there that would work better. um,
Okay.
and so that's why I do this for free. I offer that part for free,
And
because
you'll
I
give
just
them some recommendations.
absolutely. And then it's
Okay.
up to them to decide what they feel comfortable with. And if they want to keep asking questions, and,
They
if it
can.
works out, then it's something that I have that, I've recommended and they want to go with that, that's great. If not, it's completely up to them. I'm not going to chase after anybody. And, I want them to understand and feel comfortable and think and feel in their heart that that is the right option for them as well. So,
Perfect. And then they'll have access to their calendar, so it's a calendar link that
yes,
they can set that up, which means they can do it at the convenience of them.
right.
And you have your availability time sitting there. So I do encourage anyone to please take advantage of this, gift to us, that you can get an opportunity to find out what options are actually available to you at this point in the game, because it is confusing and trying to navigate this world and all this terminology. And a lot of us, yes, technically we're at home more, but I'm not really seeing a lot of extra free time, because there's always competition between the kids for Zoom and us using Zoom and staff meetings, and it's just crazy. And I do
Mhm.
believe you do virtual consultations as well, so if you still want to
Yes.
get that face to face, you can
Hmm.
still do that, and you use
Hmm.
Zoom as well. So there is some really great opportunities out there. And
Yes.
it is time to excel. Make sure you get these things in place now, not
Yes.
when it's basically in the middle of the chaos.
Right.
It's ready to go. So this has been absolutely wonderful. I'm starting to figure out how to work a
Yes.
second computer here to kind of keep up with comments too. And Anna, I do want to thank you. And she's confirming, of course, that no pressure approach. She also knows you pretty well.
Hmm.
And she had mentioned about international travel, which I think we were talking when we were saying about traveling and things like that. If
Hmm.
we ever can do international again, something to consider.
Yes.
And kind of going from there.
Hmm.
But yeah, just basically knowing whether or not you can meet what you're up against. So financially speaking, as well as services, the package, you're helping us to figure that out. And that I'm really, so you're going to be conscious of the budget too. And that's
Right.
always a big one for me. I like budget numbers, which is
Yes.
probably why we've connected. But
Yes.
it's got to be a balancing act.
Sure.
And that's the trick. And by you willing to help us to do that, that's wonderful. So I would encourage you to take advantage of that. And cheaper is not always better, but more expensive may not be right either.
Right.
So, and 9 times out of 10, it may be a blended approach. And that might be half the battle. So
Right.
take advantage of that. That your calendar link is going to be put into there. Is there any last comments that you have that you want to share that you can think of
Um,
right now? Because
I just,
you've been great about it.
yeah. I really think just being prepared
Okay.
before something happens. Like right now, people are preparing for that hurricane. And these
Aha.
are people who are probably well versed in what a hurricane,
Yeah.
these people have been around the block a few times when it comes to hurricanes. Health and life insurance, that is another thing that, just having that preparation when you're
Okay.
not in panic mode is probably that's when you're going to make the best decisions. That's
Hmm.
when you are going to feel the most confident. And then,
Sure.
making a decision in panic mode is usually not a great thing to do. So definitely
Okay.
think about those things before something happens, or before, you know, you know, I just know that it's prepare before you need it for sure.
Perfect. Wonderful. Well, thank you so much for taking, the time to join me today and to help those to excel, because as I said, both of us are together. We want to inspire them. We want to ignite the possibilities that are there for them so that each
Absolutely.
and every one of us can excel, and we get to excel together on this journey. So thank you so much for
Well,
joining us
thank you for
today.
having me.
And come on back next week. Check us out. These are hosted every and it's a different guest, it's different opportunities, different training. Do not forget that my second Wednesday of every month is a little bit different variation, of course, and that is my virtual lunch and learn. So we get a chance to just learn and excel together, but on that second Wednesday, we get to actually jump in and actually have an actual live networking opportunity as well. So be on the lookout for that. That's just going to be in a couple of weeks, but we hope to see you back here in next week at 11:30 on It's Time to Excel. And Mindy, thank you once again, and thank you for those that join live and those that grab on the replay. We just appreciate all the support they've given, and make sure you take advantage of Mindy's gift that we prompted out there on that comment section just really soon. Have a good one. Bye.
Thank you. Bye.